Good morning, everyone. I'd like to thank you all for attending our first medical marijuana availability seminar. As you know, medical marijuana is now readily available at a number of locations across Pennsylvania. The state has worked vigorously to prepare for this moment, and we as legislators and healthcare professionals have worked vigorously to ensure we were prepared for this moment and for all the questions that follow, which is exactly what brings us here today. The entire point of this seminar is to provide those who are interested in learning more about the state's medical marijuana program with the accurate facts you need to know. Regardless of whether it's for you, for your own benefit, or the benefit of others, and we want to show you what you should expect from this seminar. First, information on what you or your caregiver need to do in order to be eligible for this program. Second, information on how practicing physicians are involved in the state program. And third, information from our local processors and dispensers about their businesses. Following the presentation from Pennsylvania Department of Health, which should answer a number of your questions, we'll also hold a question and answer session in hopes of providing you with more information. Thank you again for attending today. I hope you find today's seminar helpful. Providing patients who suffer from serious medical conditions with the relief they need is not only important to me, but it's important to all of us who create and vote on policy in Harrisburg. So it makes me happy to see something like this come to fruition, and it makes me even happier knowing it will provide relief and comfort for those who truly need it. With that, I'll turn this over to our speaker from the State Department of Health, Lolly Bench. Lolly is the patient liaison for the Office of Medical Marijuana in the Department of Health. She's been with this office since October of 2016, not long after Pennsylvania's Medical Marijuana Act was signed into law. Her role as patient liaison to ensure the voices of patients and caregivers are heard and to ensure their needs are met to the best of her ability as the medical marijuana program continues to evolve. Previously, Lolly directed the efforts of the grassroots organization Campaign for Compassion, which was the group of patients and caregivers who, with the support of key legislators in the Wolf administration, spearheaded the campaign to bring medical marijuana to fruition in Pennsylvania. Lolly began her advocacy work in the fall of 2013 on behalf of her young daughter, who at the time suffered from intractable epilepsy. Lolly is always eager to share about her family's journey in medical marijuana. Here's Lolly.
Thank you. Thank you. Can everybody hear me okay? Okay. So I kind of want to just walk around a little bit. So I will try to stay on track with this PowerPoint, but I may wander off a little bit because we have a lot of information to go over in a relatively short period of time, and we want to leave a lot of time for Q&A at the end. So I hope I don't get too into the weeds, but again, it's just so much information to go over. If you want me to clarify something, feel free to just give me a wave if I'm not explaining something efficiently. Okay, so our goals at the Department of Health are to provide access to medical marijuana for patients with serious medical conditions. We want to ensure safe and effective methods of distribution, and we want to promote high-quality research into the efficacy of medical marijuana. Now, there are people who will qualify for a card for this program, and there are people who may not qualify for a card for this program. So first of all, you must be a Pennsylvania resident to be a patient in this program or a caregiver. And you must be diagnosed with one of the now 21 qualifying conditions. And we will go over all of those and your steps for participation. But again, you must be a resident of the Commonwealth, and you will need to be certified by one of the registered practitioners as having one of the qualifying conditions. So, caregivers are also participants in this program. So if a patient is a minor or a homebound patient, inpatient, they may need the assistance of a caregiver. So there's actually a path for a caregiver to be the patient's proxy in the system and really navigate the entire process on their behalf. And then they are the patient's card holder. They're able to go into the dispensary for the patient. So every patient can have up to 2 caregivers to assist them with that. So yes, patients under the age of 18, that's one of our cute little kiddos, Sydney. Patients under the age of 18 are able to participate in this program through a caregiver. Patients under the age of 18 do not get a card, okay? All right, so a caregiver can have up to 5 patients. A patient can have up to 2 caregivers. That's how that works, and we can't really bend those rules too much. There are key participants in this program, and we will go over the role of each of those participants during this presentation. So I wanted to first show you the supply chain. This is pretty important, especially if you are mindful of preventing diversion from the program. So the program has department oversight, and we have this pretty intricate, magnificent system called a seed-to-sale system, and that is tied to the patient and caregiver registry. And the Medical Marijuana Act in Pennsylvania required the Department of Health to set up all of these things to monitor the program. So the seed-to-sale system actually tracks the medical marijuana from the seed or tissue sample at the grower processor all the way to when it gets to a patient. So I don't know how all that works exactly because I don't work for the grower processor, but I think we have a gentleman up here that will help with that a little bit, help you to understand how that works. But I do want to also point out we have 2 phases of laboratory testing. So once at harvest, the product is tested, and then once after it's actually processed into whatever form the patient is going to actually obtain at the dispensary. And the labs have applied to the Department of Health, and they have met a certain criteria, and they have been approved to be labs that are testing our products in Pennsylvania. And these labs are actually going into the grower processor facilities and getting their own samples. So those samples aren't provided for the lab. So you're saying, this is what I want you to test. The labs are actually going in and testing what picking the samples that they want to test, which I think just ensures that we're getting a safe product. And it's tested for molds, pesticides, heavy metals, residual solvents, but most importantly, it's tested for the cannabinoid profile of the medicine. So the patients need to know how much THC, how much CBD is in their medicine. That lab testing will allow them to know exactly what they're purchasing. And I think that's what makes this program important. That's why states need to have a medical marijuana program, because, prior to this, there were a lot of patients that I was getting to know, and I had some experiences myself where you were forced to obtain medical marijuana outside of a medical market for medicinal purposes, but you don't know exactly what you're getting, and you don't know what's in that medicine. And I think it's so important that patients know that what they're getting is safe. So I think my favorite part of this program is that we have lab testing. One of my favorite parts. Okay, so these are the forms that a patient is able to obtain at a dispensary. So if you have been really keeping your finger on the pulse of all of this, you might know that when the act was signed into law in April of 2016, it did not include the dry leaf or flower of the plant. It was an extract-only program. And while we were celebrating the victory of having the ability to finally establish this program, we knew that that would be crippling to some patients because financially it's very difficult to be able to afford the extracts sometimes. And because insurance does not pay for this medicine, we want to make sure it's affordable. So we have this really fantastic group of 15 very different individuals, and they make up the Medical Marijuana Advisory Board. And that board is chaired by Dr. Rachel Levine, and that board was tasked with collecting feedback and looking at other state programs. And then they issued a report last May with their recommendations on how the Department of Health could improve this program. And one of their recommendations was to add the dry leaf or flower so that the patients have a more affordable route of administration. Okay, so I want to make something very clear. The Act does strictly prohibit something. So the Act does prohibit smoking of the medical marijuana. So we do want to encourage vaporization. There will not be like joints sold out of a dispensary. And some medical markets do allow that, but Pennsylvania will not allow that. So you can buy vaporization devices, and you can buy the dry leaf or flower that you can then vaporize. So this is a picture of some of the products that you might see in a dispensary. So if you see some news clips about this issue, you might see like the B-roll footage from other states. And I think one of the very common images that's used is a what's called a bud tender. And they have a jar of the medical marijuana in the flower, and they're getting buds and putting it into a container at the dispensary, at the sales counter for the patient. That's not going to happen in Pennsylvania's program. So when you go into a dispensary, you will see products like this stocked, and you purchase products that are sealed, and they are in child safety containers. You're not allowed to open those containers at the dispensary. You leave with them just like that. You can't actually see what's in them. Now, I don't believe these 4 white containers on the left are for capsules. However, that's a very typical container for the dry leaf. Okay, so you'd actually get it in an opaque container that's got a child safety cap on it. Okay, so grower processor overview. I don't want to get too much into this, just a high-level overview. No one under the age of 18 is allowed to work for a grower processor. Everyone has to have a background check done, and the grower processors have applied, and they have been issued a permit by the Department of Health. And I'll go over the numbers for the grower processors in a little while. But these are really sophisticated facilities. They're very clean, they're very efficient, and they know exactly what they're doing. I think Pennsylvania has the best of the best. Okay, lab overview. I sort of already went over that, so I don't want to get into it too much more now to save us a little bit of time. Dispensary overview, this is really important. So the dispensary, our director always says they look more like an Apple store than a head shop, and I think that that's very true. These are really nice facilities. When you walk in, sometimes you might feel like you're walking into a spa. They're beautiful, clean facilities with very professional staff. And I think they're really, really well run. I want to go visit the one here in Scranton, and I've heard nothing but good things about them, but I will go check that out. But every dispensary has on staff a medical professional, and I think this is really important. So we're required by law to make sure that there is a medical professional on staff at the dispensary to perform patient consultations. So because this is a medical program, it's medically focused, we want to make sure that patients are leaving there with the product that's right to treat their condition. And so we have a requirement that at each facility, they have a MD, DO, or a, what is it, George? Pharmacist. Yeah, so you will see one of those medical professionals on staff, and you will have a consultation with them. And they sit down and go over probably your prescription drug list. If you're on prescription drugs, they want to check out what you are already on to make sure that there's no drug interactions that need to be taken into consideration. They'll go over what your objective is, what symptoms are you trying to treat, so that they can best recommend the form and the cannabinoid profile that suits your disease, okay? Now, each permittee is awarded their primary permit, but that allows them the ability to open up to 3 facilities. So at their primary location, you'll see the pharmacist or MD or DO, but at their second and third location, you may see a physician's assistant or a certified registered nurse practitioner. But like I said, always a medical professional on staff during operational hours. Okay, so physicians, we're going to actually hear from one of our certifying physicians. So I'm very anxious to hear everything that he's going to share with us, but how he participates in this program and how every practitioner wants to participate in this program is first to hold a Pennsylvania medical license. So they can be licensed in a lot of states, but they need to be licensed in Pennsylvania. So we do have practitioners who practice in Delaware or Maryland or wherever nearby, but they hold a Pennsylvania medical license, so they can register for this program to issue patient certifications. So as soon as they register, they are then prompted by the system that they register in to complete a 4-hour training that's required by law. We have 5 training providers available for them. All of this information is on our website. There's 5 training providers that they can choose from, and then they complete the required 4-hour training when they have the time to do that. And then they are vetted by the department to make sure that their license is in good standing. And then they are approved to be one of our practitioners who can issue patient certifications. So not just any doctor. And the caregiver, or rather the practitioner registry, has had a negative impact on some programs in other states. And we did worry initially that we wouldn't have enough physicians signing up, but we are doing extremely well right now. We have over 1,500 physicians signed up. Over 1,000 physicians have been approved by the department to issue patient certifications. Of course, we need to see more, but that is really good for a year into implementation. So these are the 17 original conditions that were included in the Act when it was signed into law. And this is a pretty good conditions list. There was a couple here that I think really could make or break the program. And one of those is severe chronic or intractable pain. And that was, I think all of us were tremendously grateful to have that addition to this program. But there were some missing, such as terminal conditions. We wondered where was the just plain compassionate use. And there were a lot of patients with terminal conditions that still didn't qualify for the program, unfortunately. So again, that 15-member amazing board made recommendations to add several conditions to the program, one of them being terminal illnesses, also neurodegenerative diseases. We were missing Alzheimer's and dementia. We now have those included in the neurodegenerative diseases. So I will forever be grateful for what the board has done for this program in its expansion. Now you'll see the third one down, opioid use disorder. And I think sometimes when I'm going over this information, that sort of gives a pause, and I can sense that there's some kind of wonder about why that would be on the condition list. And that's because there is research that points to this being an excellent replacement for opioids, or something that can be used in conjunction responsibly with the oversight of a practitioner. But I think the most important thing about this is, as we move forward and go into the research program that's going to be launching in Pennsylvania, The research entities can only research conditions that are included on this list, and we need them to be able to research opioid use disorder. There was a study published in JAMA several years ago that showed that states that had implemented programs had, in 2 years of implementation, a 25% reduction in opioid analgesic overdose deaths. And within 6 years of implementation, they had a 33% reduction in opioid overdose deaths. That is very good stuff. So I'm very anxious to see what's going to happen in Pennsylvania here, anxious to have a look back and see how this program has had a very positive impact and hopefully significantly decreased the number of opioid overdose deaths we have in Pennsylvania. Okay, so how do patients register? So this is, I think, this is what the takeaway hopefully will be. I want everybody to be able to walk away from today with all of the information they need to move forward. And real quick, I have to give a shout out to Representative Flynn and his amazing staff. They did such a nice job of putting this together, and I'm just going to wonder just for a minute here. You're going to hear how to register. You're going to hear from a certifying physician, and you're going to hear from someone who operates a dispensary. And so I think leaving here today, you'll just feel so much better. If you have any doubt that you might be able to participate in this program, I hope that you leave here with all of the knowledge you need. So thank you so much, Representative Flynn, not only for being a huge supporter of this issue for years, but for also putting together such a cool event for your constituents. Okay, so I'll get back on track here. So a patient's first step is to register with the department. We were required by the Act to have a patient and caregiver registry. So again, this registry sort of marries the seed to sale system. So we have a system that allows us to keep track of everything. It's a very, very sophisticated system. If there is an adverse event, if a patient has an adverse event with medical marijuana, we are able to track all the way back to the grower processor and track to see what perhaps caused an adverse event. So that's really good news for, I think, everyone in Pennsylvania. It just shows that we are doing this responsibly and efficiently. So again, registering with the department is the most important first step. Now, as I mentioned, caregivers can register on behalf of patients. So not everybody wants to sit down at the computer or even has access to a computer. So there is the ability for a caregiver to assist you with that process. So your first step is to register using, excuse me, using your state-issued ID, your driver's license or state-issued ID. And that is just to verify that you are a citizen of Pennsylvania. Okay, so then the second step is to have a patient consultation with one of the registered practitioners. There is a list of registered practitioners on our website, but there are some practitioners that have opted out of that public-facing list. They have the ability to do that if they don't necessarily want to issue certifications for patients who are not already on their service. They can opt out of that public-facing list and still issue certifications. But if you are looking for a certifying practitioner, you can find that list online. But I will tell you, even then, sometimes it's very difficult to find somebody in your area. That list is broken up by county. You do not have to have a consultation from the practitioners in your county. You can, of course, travel anywhere in the Commonwealth. But it can still be very difficult to find someone who's accepting new patients. So you're more than welcome. Please reach out to the Department of Health, and we are more than happy to assist you in locating a practitioner. So that's your second step. And then your... PA.gov, right, Lolly? Pardon? PA.gov. Yes, it's, there are postcards out there and brochures that have our website information, and that it's pretty easy to remember. It's www.medicalmarijuana.pa.gov, okay? But please make sure you take some of our brochures with you as well. So after you're issued that patient certification, the registry then sends you a system-generated email letting you know your certification has been submitted by your practitioner. You can now go in and pay for your medical marijuana ID card. So no patient can get a medical marijuana ID card until they have been certified by a practitioner, okay? And again, that certification is verifying that you do have one of the 21 qualifying conditions. The certification may also include limitations or restrictions if the practitioner feels that that's necessary. And the practitioner may also have a box checked that says, I recommend my patient have a consultation with the medical professional at the dispensary. Now, just because they don't check the box saying that you should have a patient consultation doesn't mean that you don't have a patient consultation. Some dispensaries require every single new patient to have a consultation with the medical professional on their first visit. So it really depends on the dispensaries. They have their own set of standard operating procedures, and they will tell you exactly what their expectations and requirements are as well. But again, the third step, log in and pay for that card. Now, what's next? Okay, this is really small, and my sincerest apologies, but it's so important to see this. Can everybody see it a little bit? Yeah? Okay, so this is the landing page for the registry. And you'll see here under the green heading providers, that's also where physicians go to register, and it's where medical professionals register, the medical professionals at the dispensary. Patients, there's an adult patient registration. Now that's probably your easiest to navigate path, your standard adult patient registration. You apply or register with your state-issued ID, then you go get your patient certification, then you pay for your card. Pretty easy. Under caregivers, it gets just slightly more complicated and intricate. Again, we're happy to help anybody navigate this process. But your adult patient caregiver registration, say your husband or wife wants to be able to go to the dispensary and pick up medication on your behalf. That's where they want to register. Okay, because they're going to want to get their own ID card. A lot of patients, even when they initially sign up to get their own card, at some point they may not feel very well, and it's very, very helpful for them to have somebody who can go to the dispensary on their behalf. So we have the ability for caregivers to do that. And you'll see on down, we have the caregiver registration for individuals requiring in-home support for minors or for a person with a disability. And so I am a caregiver on behalf of my now 11-year-old. So she does not have her own card. I go to the dispensary for her. So my path was to apply, choosing the third option down, and I plugged in her information, her name, her date of birth, her address, and then I put in my information, and I registered the two of us together. The system generated both of our IDs, and then we moved forward. I got my background check next, which every caregiver is required to do, and then we got her patient certification, okay? So I'm going to go over that right now. Thank you. So this is the inside of my caregiver portal here. So you see there's a home tab, a profile settings tab, make payment tab. Now, under the profile settings tab, so a caregiver is required to do a background check, required by the Act to do a background check. And it says in the Act, very specifically, if a caregiver has a drug charge in the past 5 years, they cannot be a caregiver in this program. So any drug-related charge in the past 5 years would prohibit a caregiver from becoming an approved caregiver. However, any other criminal record would need to just simply be reviewed. And, I can't say, what specifically, what other charges may inhibit a caregiver's participation, but every single record does go for a legal review. Okay? So, The caregiver, after applying with their state-issued ID, they are setting up their profile, and they can access the background check instructions at the bottom of the profile settings page. Okay? And then that takes you to the Identico site. You're required to do a very specific background check. Not only a background check, but a very specific background check. You're required to submit your fingerprints to the FBI by going through the vendor that the state police has contracted with to do this, which is Identico. So that tab, that access background check information, takes you straight to the Identico site where you can register yourself to go get your fingerprints done to become a caregiver. So that review can take about 4 to 6 weeks. So I signed up, put Anna's information, put my information, created my profile, then I went and I registered for the background check, and then 4 to 6 weeks later, I got my email saying you have been approved to be a caregiver in Pennsylvania's medical marijuana program. You can now log in and pay for your ID card. So I logged in and I paid for my ID card, and it came in the mail about 2 days later. They're super fast. It's like the one thing we do really fast. And I got that card, but I still couldn't actually use the card until Anna had a patient certification. So it's very, very important to note caregivers may get a medical marijuana ID card, but they will never be able to use that card at a dispensary unless they are linked in the registry with a certified patient. Okay? As soon as you're linked with that certified patient, your card is turned on. If you are no longer linked with the certified patient, your card is turned off. Yeah?
I'm certified.
Mm-hmm.
My wife is my caregiver. She's not registered. Do we both have to pay $50?
Yeah, that's a great question. You do. Every card you pay for individually. You can apply for a fee reduction with those cards. So if cards are $50. If you participate in Medicaid, WIC, SNAP, PACE, or CHIP, you can request a fee reduction for the card and get it for $25. Okay? Okay, so we'll go ahead and move on through. So this is an image of the card. You'll see it looks very, very similar to your driver's license if you have one of the newer driver's license. They're so fancy. But it does not have an address on it. That's very important to know. So the information on the face of the card is somewhat vague. You have an issue date, an expiration date, and your name. That's about it. It's going to say patient or it's going to say caregiver. But the information that's very important that needs to be accessed is stored in the 2D barcode of this card. Not on the face of the card, but in the 2D barcode. So when you take your patient or caregiver card and you go visit the dispensary, they have the ability to scan the 2D barcode on the back of your card and pull up whatever relevant information they need to best assist you in purchasing your medication. Okay? Let's see. Oh, you know what? I want to make sure to note as well, you only have to pay for one patient card per year, but that doesn't mean the card is good for a year. So a lot of practitioners may issue a patient certification for 3 months, for 6 months, 9 months. They have the ability legally to issue a certification for less than 1 year. But we don't want you to have to turn around and pay for cards every time you have to get a certification. So the payment is now required annually rather than per card. So you'll only pay that state fee 1 time per year for your card, although you may end up getting more than 1 card. And that's why it's so important to check your email, because we will send you an email when your annual payment is due. And I know not everybody loves email, so my sincerest apologies, but we have to. Okay, so these green arrows here show you where the dispensaries are in Pennsylvania. And that, we have new arrows. I think every month there are new arrows on this map. And there will continue to be. We're going to have a lot of dispensaries. Right now, of course, you see probably the most in the southeast and southwest. They have a lot of dispensaries, but again, that will change. You'll have access to more and more dispensaries. I think you guys are in pretty good shape probably in this neck of the woods. Maybe not the folks up in Elk County, but we're working on that, and we will continue to have operational dispensaries popping up on this map. This map is on our website, and it's an interactive map. So you go to that medicalmarijuana.pa.gov, and you can click on Find a Dispensary and pull up this map. If you double click on it, of course, it makes it bigger, and you can kind of better pinpoint which of those arrows is closest to you. And then if you click on that arrow to the left, you'll see that dispensary's information pop up. And you can find their address, their name, and their phone number. Okay? I think it's really important to call a dispensary before you go. Set up that patient consultation. Have any other discussion, or maybe schedule your appointment online. You can probably schedule them online too. So, but if you do not schedule it online, be sure you call. Okay, so program updates. This is all the cool stuff that we've done, and I'm not going to go over every single thing because I'll feel like I'm bragging. But the Department of Health has done a lot of really cool stuff. So we issued phase 1 of the permits. That was 12 grower processor permits. All 12 of them have now been operational, probably for some time. Most of them have products on the shelves of the dispensaries. We issued phase 1 for the dispensaries, which was 23 dispensary permits, and now we have completed phase 2, which issued another 13 grower processor permits to give us a total of 25 grower processors in Pennsylvania, and a total of 50 dispensary permits. Again, each of those 50 dispensary permittees can open up to 3 locations. So we could end up with an awful lot of dispensaries, as you can imagine. But we know that this is a market-driven program. Every time you see another one of those arrows, every time there's another grower processor with product, those prices could potentially come down for patients. We want this to be competitive and market driven. We want to see prices come down so that patients can afford their medication, okay? Let's see here. So some more of the stuff we've done. Again, I'm not gonna go over this, but you can read it if you want. Okay, so at this point we have over 112,000 patients registered, which is huge for a new program. We're pretty excited about that. Of those 112,000 patients, over 78,000 of those patients have been certified by one of our practitioners. Some of the remaining patients may still be trying to find a doctor. And we, again, have almost 1,500 physicians signed up, over 1,000. I think it's 1,021 physicians have now been approved to issue patient certifications. Okay, so our next steps, one of our, I think, most important next steps, of course, is to continue to get practitioners to sign up for this program. One of the reasons that's super important is because one of the board's recommendations was to make it a requirement that pediatric patients could only get a patient certification from a certifying practitioner who is board certified in pediatric medicine. And right now we only have 17 physicians signed up for the program that are board certified in pediatric medicine. So Dr. Levine, being a very kind, wonderful person, has delayed implementation of that recommendation, but we will have that recommendation go into effect once we have enough board certified in pediatric doctors, okay? So we need more board certified pediatricians. We'll continue to operationalize facilities and of course implement the Chapter 20 research program. So this is, again, our website information. If anybody has questions, you're probably going to leave today and have lots and lots of questions. Or you might leave today and you might try to register for the program and have a heck of a time doing that. Please, please let us know if you need any assistance. There is a help desk number on the registry page, but we are happy to help as well. And it can be a little bit tricky. And I do want to make a note of a couple of things. So you do want to apply or register using the information straight from your state-issued ID. But if you have a change of address card, make sure you're actually using the information from the change of address card. We want to validate that information. And so you want to make sure the information you're entering in the registry is what's most currently on file with PennDOT, okay? And lastly, I just wanted to show you my little peanut. She's so cute. So I can't be humble about this one. And I just want to share just a little bit about her. And sometimes I start to cry just a little bit when I talk about her, but I sometimes think I might have PTSD. But anyway, her name is Anna, and Anna has mesial temporal sclerosis, which is atrophy in the hippocampus of the left temporal lobe. She also has cavernomas in her frontal lobe and autism. So a lot of stuff for a little tiny person to be dealing with. And those brain abnormalities caused intractable epilepsy. And at her very, very, very worst, I want to emphasize at her very worst, she was having about 150 visible seizures every single day. And her brain was misfiring. So what she had was a 3 per second spike wave. And that means that every single second, 3 times, her brain would misfire. And that caused significant delays in her development because her brain basically did not have the ability to learn and retain information. She really just had the ability to sort of just stay functioning. The ability to swallow is a very big deal for someone in that sort of condition. So I'm very grateful that she never lost that ability. But that was what Anna was dealing with. And mind you, this was in spite of every effort to control her seizures with what we had to choose from, with FDA-approved available medicine, okay? We did the revolving door of anticonvulsants, and we tried the extreme diets. There was one diet that's actually nicknamed the starvation diet. And it's called this because you're putting a child's body in ketosis. They actually have to be hospitalized for 5 days to be put on this diet because it can be very dangerous initially. And when we were leaving the hospital, she was eating the purple nail polish off of her fingernails because she was so hungry. And they told me, make sure you put away the dog food because she'll be so hungry she'll want to eat the dog food. And I don't say this for sympathy. I say this because I want everybody to be very, very, very clear about why this law was passed. And it was passed because patients sometimes run out of options. They don't have anything left to try. And we needed one more thing for a lot of these patients to try. And the craziest thing about what I was going through with Anna, the craziest part of it was, as we're going through this, I kept meeting parents of other children like her, and their kids were so much more fragile than mine. So I tell you what she was like at her worst, but I want you to know that there were so many children that were much, much worse off. And so as important as it was to make sure this got done for my kiddo, it was far, far more important for a lot of other patients who are more fragile than she ever was. But I will also tell you, the story has a very happy ending. I could not wait for the legislature to pass this law and set up this program. I did go ahead and make the decision to obtain medicine for my daughter out of another state, knowing that I needed to do that for my kiddo. My compass points me in the direction of what's right for my family. And so, thank you. So Anna's actually over 4 years seizure-free now. So we have a good story. Thank you. Thanks. So there are a lot of really good stories that we hear, but I want to hear more of them. And I think the favorite stories that I'm hearing right now are from some of our patients that are coming off their opioids. So as cool as it is to share my daughter's story, I also want to share that every single day, and I'm sure George would agree, I hear from a lot of the dispensary staff that they're like, weeping at work, as am I some days. this career is not for the faint of heart, but we hear stories from patients every single day about how this program has been a game changer for them. So I just want to encourage all of you to have a very open mind. Please, please continue to ask questions. If there's anything that you're not comfortable asking this panel today and you want to have a more private setting to discuss it, we're all, I think, probably going to stick around for a while after out in the table area, so please feel free to stick around and ask your questions then too, okay?
While we just change the microphones, just take a minute. I just want to remind you that my name is Tom Welby. I work for Representative Flynn. And our office is there to help you with this. Those of you that started or are going through the process have found some roadblocks along the way. Representative Flynn's staff, that being Angela Renke-Jones over here, Greg Copeland, and also Nolan Trenton, who's our employer, are there to help you and navigate through this system with you and perhaps accelerate some of the issues that you might be facing. If you call the office and you get me, ask for Angela, Greg, or Nolan. They're really good.
Okay, wait.
Dr. Mark Cruciani. He's a rheumatologist in Scranton, Pennsylvania. He's licensed to prescribe medical marijuana and specializes in rheumatology and internal medicine. He's affiliated with multiple hospitals in the area, including Geisinger Community Medical Center and Moses Taylor Hospital. He received his medical degree from Georgetown University of Medicine. Has been in practice for more than 20 years. He's also one of 4 doctors at Geisinger Community Medical Center and one of 5 at Moses Taylor Hospital who specialize in rheumatology. He's a member of various medical organizations, including the Lackawanna County Medical Society and the PA Society of Rheumatology. He's received countless awards over the years, like the Quality of Life Public Educator and Community Leader of the Year. His practice is currently located at 1418 Wyoming Avenue in Scranton. Mark?
Good morning. Can you hear me okay? All right, very good. Does anybody need to get up and stretch? So I don't have any medical marijuana to give you right now, okay? All right, but we're going to be talking about pretty much the medical side of it. And a brief history of cannabis. It was first used by the Hindus in India about 2,000 years ago, before Christ. And they used it for spiritual and medicinal reasons. Then again, there was in the medical textbook in ancient Egypt, they found on the papyrus that it was documented it was used like for hemorrhoids and inflammation, different things like that. Then in 1600, Shakespeare and Queen Victoria were also using cannabis. And then by 1800, was available for purchase in U.S. stores and pharmacies legally. You could get it, go right over the counter. What do we got here?
We're experiencing technical difficulties.
And then it is still used in its plant form for textiles, jewelry, and different food. And what is it? It is not a single drug. It's a complex plant comprised of numerous cannabinoids and terpenes. Cannabinoids are organic substances found within the plant that have multiple pharmacological values. There's actually 480 components in the cannabis plants. 85 types are cannabinoids. There's the THC, which is the most recognized one. It's associated with reduced pain, nausea, and increased appetite. Its psychological effects are relaxation, euphoria, altered sensory perception. It could cause irritability, anxiety, and paranoia. Now, you hear a lot about CBD. This has no intoxicating or psychological effects or psychotropic properties. It's associated with reduction in convulsions, nausea, and inflammation. It also lessens the potential of adverse effects with THC, so they combine that a lot because you might want to get a little bit of each one. Now, terpenes are a large group of volatile unsaturated hydrocarbons. They're not as well understood as THC and CBD, but they call it the entourage effect, where they feel that the terpenes actually make 1 + 1 = 3. There's like a synergistic effect with the terpenes. Okay, so there's some important information I want you to know. First of all, the federal government has classified marijuana in general as a Scheduled I controlled substance. And the reason for this, they feel that it has a high potential for abuse. There's no currently accepted medical use and treatment in the United States. There's a lack of accepted safety for use under medical supervision. Marijuana has also not been approved by the FDA for marketing as a drug, and the manufacture of medical marijuana is not subject to any federal standards, oversight, or quality control. So I'm talking mainly federal. We're here at the state level, but I need to say that just so we're all covered here. Okay, here are some different pictures of it, and they come in the vaporization or nebulizer form, the topical form, the liquid, the oil, pill, and tincture. And I'm sure we're going to be getting into that later when the distributor talks. Okay, these again are the qualifying conditions. Now I'm going to go over each one of these. This is the medical aspect. Some of you might even suffer from some of these here. And I'll just kind of try to educate everybody about each one. Okay, the first one is amyotrophic lateral sclerosis. Those of you that are baseball fans know that this is called Lou Gehrig's disease. Okay, it's a motor neuron disease. It does not affect the sensory neurons. It's a clinical diagnosis. There's no test that we can do to determine the disease. The early symptoms are often overlooked. People have difficulty walking, lifting, speaking. Then they have involuntary twitching of muscles. There is disease progression with extreme muscle weakness, paralysis that'll spread to the arms and the legs, and then eventually paralysis with difficulty swallowing, speaking, and breathing. They do retain their sensory perception, though, which is taste, hearing, smell, and touch. Okay, autism. Autism is a wide variation of underdeveloped social skills, communication, and cyclic behavior out of character for a child. It's basically a disconnection with others. They have no empathy. They're indifferent to human interaction. They can have emotional outbursts. They have developmental delays. Their language can be delayed. They might not talk for the first couple years of their life. They have difficulty understanding facial expressions, like even a smile they might not know. They have abnormal behaviors, repetitive behaviors. They have pica syndrome. That's where they eat things that are not normal for food, like ice, dirt, lead, different things that we normally wouldn't eat. And they have very high sensitivity to external stimuli. Cancer, we all know about cancer, and the cannabinoid effects help with nausea, appetite stimulation, pain relief, and improved sleep. Inflammatory bowel disease. This is characterized by chronic inflammation of the digestive tract and extragastrointestinal manifestations. It's diagnosed with blood work, colonoscopy, with biopsy, and radiographic tests. It's not the same as irritable bowel syndrome, though, which is more like a spastic colon. People get these two confused a lot, where with inflammatory bowel disease, there might be ulcerations, inflammation, and such type of damage. Here's one of the types of inflammatory bowel disease. It's called Crohn's disease. These people have abdominal pain, cramping, a lot of bloody diarrhea, frequent bowel movements, a lot of pain with this disease when it's active. They also can get skin problems, as you can see. The one on the left is erythema, where they get like bruising all over their legs, and then those can lead to ulcerations, which is called pyoderma gangrenosum. So this is a pretty common disease. So I've seen a lot of this. Spinal cord injury, you can get damage to the nervous tissue of the spinal cord. These people, from car accidents, from football injuries, different types of injuries that, could cause paraplegic, quadriplegic, even spina bifida, which is a patient that is born with a spinal cord disease. So that's that one. Epilepsy, you heard a little bit about epilepsy in the previous presentation. This is a disorder of the brain that creates abnormal electricity, causing seizures. There's a simple partial, there's a complex, there's an absent seizure, and then as we heard, there's intractable seizures. And the patients usually do very well with this as well. Multiple sclerosis. A lot of us have heard about multiple sclerosis. It's a disease where the immune system eats away at the myelin sheath of nerves. Myelin sheath is like the skin of the nerve, okay, like a banana, the top of it, and it causes patching through it, okay? It disrupts communication between the brain and the body. The various symptoms are impaired vision, optic neuritis. If you diagnosed ever with optic neuritis, you are considered to have multiple sclerosis until proven otherwise. Okay, pain, fatigue, impaired coordination. A lot of these patients have problems with their bowel, their bladder, sexual dysfunction, a lot of numbness, tingling, twitching. They have their brain is affected with uncontrollable bouts of crying or laughing. And these can happen over different times. They might not all happen at the same time, but as things progress, they might get more and more of them, or they might wax and wane. So the diagnosis of this, you want to see it in two separate areas of the brain, evidence of damage occurring at separate times and points. Of course, you want to rule out other problems. Neuropathies. This I see a lot of. There are three types of the peripheral nerves. They affect the peripheral nerves. There's the sensory, the motor, and the autonomic. And the motor is your muscles mainly, okay? And then the autonomic is the involuntary function, things that just happen on their own. And what are some of the causes? The most common one inherited is Charcot-Marie Tooth disease, which is basically it affects both the motor and the sensory of a person. Usually happens in adolescence or early childhood, early adulthood. These patients usually have real high arches, and they have hammer toes. Hammer toes is when the toes go up in their feet for no reason at all. And it also affects the nervous system. Then you have, a lot of us, you hear about diabetic neuropathy. There are commercials on TV for some meds that treat that. Kidney disease, drugs. A lot of the patients that are getting cancer drugs can cause burning, can cause damage to their nerves, okay? A lot of these cancer drugs have a lot of side effects. So that's, the medical marijuana helps treat that. Also, hyperthyroidism. That's a gland in the neck that when it makes too much, it causes burning of the nerves. Also, vitamin deficiencies. People with especially B12 deficiency, thiamine deficiency, they can have, they get a neuropathy in their distal hands and in their feet. Alcohol abuse has been known to cause that. That's big with thiamine deficiency. And then you see heavy metal exposure. People with lead exposure, mercury exposure, arsenic can cause a lot of this burning. This is one of the biggest groups that I see. And then any kind of physical trauma, like if something drops on your feet, crushes the nerves, that could cause a painful neuropathy. Some types infection, Lyme disease can cause neuropathies. That's a type of infection. And then you have various autoimmune and chronic inflammatory, which is a lot of the rheumatology that I see, like lupus, rheumatoid arthritis, different autoimmune. Parkinson's disease, it's a loss of brain cells that produce dopamine, causing a progressive disorder that impairs movement. These patients also have what we call a masked facies. They can't make facial expressions very well. They also have a resting tremor, uncontrollable tremor all the time. Their movements are very slow, like they can't walk like fast or run or when they try to feed themselves. And they have difficulty with balancing and their limbs are very stiff. That's with this slow movement. Post-traumatic stress disorder, we've been hearing a lot about this in the news with the wars and everything, but this is a disorder in which a person cannot recover after experiencing or witnessing a life-threatening event or experiencing frequent traumatic events such as abuse. I don't think too much more has to be said about this. Most people know when they have it and have a long history of trying to get better from it. Sickle cell anemia. This is seen more in the black population, the Afro-Americans. It's an inherited blood disorder that causes red blood cells to change into a crescent shape or a sickle shape when there's a decreased oxygen. This is very painful. I've seen many, it's called a sickle cell crisis, and these patients are in a lot of pain. It causes clumping of the red blood cells in small blood vessels, and it blocks off any oxygen that can get to the organs. Glaucoma. Glaucoma is a loss of vision. There's two types. There's the most common is the open angle, which is a slow loss of vision, usually in older people. But then there's the acute, which is a medical emergency. That's called angle closure. That usually occurs with sudden loss of vision. That's an emergency room situation. And there is a childhood glaucoma, and that's where the cornea gets real clouded, usually with a lot of exposure of oxygen, and they get a lot of tearing and light sensation. HIV and AIDS, there's 35 million people worldwide that are affected. And there's about 36 million deaths since the 1980s, and medical marijuana is approved for this condition. Huntington's disease is a fatal genetic disorder. It causes breakdown of the nerve cells in the brain, and these patients pretty much shake all over. They have both involuntary and voluntary movement is impaired. Luckily, it's pretty rare. But it does cause a lot of cognitive dysfunction and psychiatric dysfunction as well. Okay, here's one that Lola was talking about, that a lot of people have gotten relief of severe chronic intractable pain, in which conventional therapeutic intervention and opioid therapy is contraindicated or ineffective. Like they have tried it previously. That was pretty much what has been going on in the last 15 years. So this is a big one. Okay, what are some of the side effects of marijuana? It can cause dizziness, anxiety, confusion, sedation, could lower your blood pressure. There could be impairment of short-term memory, You can't blame it on your age on that one. Euphoria, difficulty in completing complex tasks, may affect the production of sex hormones that lead to adverse effects. It could cause some restlessness, could cause some paranoia, psychotic symptoms, general apathy, depression. It could exacerbate schizophrenia in people that are predisposed to that disorder. Doesn't cause it, but it could exacerbate it. Altered perception of time and space, impaired judgment, excessive talking, excessive eating, and many medical marijuana authorities claim that the use of medical marijuana, especially by persons younger than 25, can result in long-term problems with attention, memory, learning, drug abuse, and schizophrenia. And I'm not saying that all these can happen. It's just kind of like a commercial on TV where they talk real fast, all that can happen. So, yeah, you just got to know that this is a part. Correct.
But who are the authorities? That's what I'm wondering. The medical marijuana authorities that say that about kids.
About kids?
Yeah.
The question is, who are the authorities? I think what it is when they have done the limited studies. That's why I had to say at the beginning that it's not federally approved, but they just want everybody aware when they go to get it that anything like this could happen. Okay, so some of the common cannabis plants are an indica, which is a short, bushy plant that grows fast. This has a higher CBD to THC ratio, and it helps increase mental relaxation, decrease nausea, decrease acute pain, increase appetite. I have increased appetite twice, and it's for night use. And then there's the sativa, which is a thin, tall plant with narrow leaves, and this has a higher THC to CBD ratio, and it's supposed to help with anti-anxiety, antidepressant, treats chronic pain, increases focus and creativity, and more for use during the day. So the pharmacist will help you trying to decide which of these blends that you may want to use for your particular condition. And basically, is there help for the opioid crisis? That was already touched upon. A lot of doctors do feel uncomfortable recommending it, but I feel personally that if this is going to help someone that wants to try it, and now that it is legal, hopefully we can get people off some of the opioids and help with the medical marijuana. So it's just know that it isn't at the federal level yet. And when it is, hopefully we'll have more studies done. So that's about it. I wanted to go fast because I wanted to leave it open for the dispenser.
Next, we're going to have George DiNardo from Columbia Care. As you guys know, in the Kaiser Oak Shopping Center in Scranton, that distributor or dispensary is owned by Columbia Care, and George is with Columbia Care. He's been the director of operations for the Pennsylvania and Delaware markets. Prior to Columbia Care, George's experience spans over 22 years in purchasing, business development, operational and financial management in the telecommunications and aerospace defense industries. The majority of his professional career has been spent in developing strategic vision and execution of operational plans with both incubator and startup companies. He holds 2 patents with 4 additional patents pending. He most recently served as vice president of Lancer Systems. He received a BS in chemistry and a BA in political science from King's College, locally here, and a MBA with a concentration on international business from DeSalle University. Columbia Care is the first and the largest medical marijuana healthcare company to operate both dispensaries and cultivation centers across the United States. They are a patient-centered healthcare company setting the standard of care for medical marijuana. Their mission statement professes 4 key commitments: safety, excellence and expertise, scientific leadership, and compassion and care. Here's George.
Thank you. Thank you, Representative Flynn, in inviting us to present here. And the best part about being the third presenter is I have like 2 words to say. Thank you for coming. A lot of the information got covered. I'm going to talk a little bit about Columbia Care, and then we can open it up for questions after. This is the fast part of the commercial, so I'll just skip over it real quick. You know, we talked a little bit about Columbia Care. We do consider ourselves the standard of care for medical marijuana. Within our dispensaries, and I'll talk a little bit later, each one of our dispensaries has a pharmacist. So we do not go to the registered nurse or the physician assistants for our second or third locations. We have a pharmacist in each location, as well as most of our staff are medical marijuana card holders. They understand the effects of the different strains, the terpenes, so they're actually speaking from personal experience as well when they're giving out their recommendations to everyone. Columbia Care, we do believe that we are the largest vertically integrated multi-state operator in the U.S. We have recently just won in Virginia as well as New Jersey. We also just won in Europe, in Malta. So right now, you know, we have a footprint from the west side to the east side of the United States as well as in Europe. We model all of our industry standards after the pharmaceutical industry. We have a medical advisory board within our cultivation process. We utilize any of the pharmaceutical standards that Big Pharma would utilize in the cultivation of our products as well as the processing of them. We have always been in full compliance with state level regulatory for the past 5 years. No fines, no warnings. We make sure that we have a great line of communication with the Department of Health in every single state, and as well as within each state, we talk amongst Columbia Care in regards to the best practices that we can apply to our facilities across multiple locations. So far, we have successfully completed over 1.5 million patient interactions. This goes into a central database that our pharmacists, as well as our sales associates, have access to. So with over 60 qualifying conditions across the U.S., we're able to go into that database and actually take a look at patient interactions, what worked best for them, for their specific condition, and then we're able to formulate our suggestions for our patients based off of that. And as we continue, we're constantly adding to that database, and we're formulating presentations to our pharmacists every month in regards to anything that we've learned in multiple states on different strains and products that are maybe working better for patients or not. So we make sure that we utilize the full breadth of our knowledge across our multiple states as well as international locations, and making sure that we're giving the best guidance to the patients that come into our facility. Strong working relationship with local and state law enforcement agencies. We also want to make sure that when a patient comes into our facility, they feel safe. They feel that it's a safe environment for them to meet with the pharmacist, to work with the staff. Every single facility, we have both during all operational hours, security guards. Every facility will have approximately anywhere from 40 to 50 cameras. That way, if we talked about, Lolly mentioned diversion prevention. Every night we do physical counts of all inventory. If any product goes missing, we review the footage. We contact the patient, say, hey, by any chance, did you get this instead of this? So we make sure that we monitor every interaction that's going on in our facility during all operational hours, and then it's also monitored during non-operational hours. So, when someone comes in, they want to make sure that they're getting the best advice possible and that they're safe. And those are the 2 points that we definitely stress within our facilities, that patients feel safe and that they're getting the best care. We have several strategic partnerships throughout the U.S., Arizona State, Dana-Farber Cancer Institute, University of Pittsburgh, Mount Sinai Hospital, and we work with all of these facilities in gathering the physicians' knowledge that they're learning and actually starting to try some of the clinical research that, in all honesty, it's lacking right now in the industry. I would love to see more clinical research out there and educate. You're going to have both advocates and you're going to have people not understanding the benefits of medical marijuana. The more we can educate the communities in regards to the benefits, the better it is for everyone involved in it. Currently, right now, Columbia Care and Columbia University are actually working on a study for the opioid crisis. Governor Wolf, if you follow them on social media, that is a very large part of what his campaign was. And we want to be able to extend this into Pennsylvania in understanding, pilot data demonstrating, 2/3 of neuropathy decreased or stopped opioid use. And Columbia Care, within our other vertically integrated states, we actually have dose metered. So we make sure that every time you're taking the medicine, it is actually metered. You're getting the same dose every single time. And what we're going to try to do with Chapter 20 is bring those products to Pennsylvania. We've been awarded the only R21 research grant that studies cannabis and opioids. And the research is being led by Arthur Robin Williams, and we're working with them in regards to that. The Center for Discovery, we have a collaboration right now in treating epilepsy, utilizing cannabis-derived medicines. It's an observational study. We're enrolling the 50 patients, and then we're going to evaluate the optimal dose. What decreases the amount of seizures? Currently in PA, there's 6 regions. So everyone says, okay, so where are these folks located? And, Lolly discussed the number of permits. Basically, you win a permit for the region. So right now, we have a dispensary permit in Region 2. So we have our Scranton facility in the Kaiser Oak Shopping Center. We have a dispensary in Wilkes-Barre off of Kidder Street. And we recently just opened up a facility in Allentown. We will apply for Chapter 20. The applications come out in March, and then they're due in April. And our goal is to perform clinical research in the state of Pennsylvania. And it could be a multitude of different ailments. So we're looking at, anywhere from studies on Crohn's, studies on chronic pain, studies on epilepsy. We want to make sure that we cover the 21 different qualifying conditions that are in PA, and make sure that we can get some data out to the communities in regards to the effectiveness of cannabis products. With that, Chapter 20, you will get 6 dispensaries as well as a grower-processor location. And that is one of the main reasons for the Chapter 20 is we believe that with our patented technology on meter dosages for specific products, we believe that we can actually provide a benefit to the medical community, not only with the accredited universities, but also in educating physicians that register with the program. Community impact. We look at both local, regional, and state. So from a local perspective, job creation, skills training, community revitalization, patient education, physician outreach, internship programs. There is a reluctance in having students at, say, Misericordia, University of Scranton, and I'm not calling them out by name. I'm just giving you examples in this area. But having, there are physician assistant programs here. There are nursing programs here. Educating those students, letting them come in and see what the program is and give them another viable career choice as they continue their education. That's something that we want to get involved with. For physician outreach, we are constantly on the phones with physicians. We have physicians calling us saying, hey, we have patients coming to your dispensary. Can you help us in understanding how they're feeling? We haven't seen them. Some physicians, it's maybe once a year you see them. So we make sure that, without violating HIPAA policy, that we have an open communication with all the physicians in the area. Patient education. With part of this is, within the next 30 to 60 days, what we're going to do is, and we're starting one in Allentown. We have one coming here. We're going to do one in Hazleton, is actually create a open session where you could actually come in. We'll have the cultivators, and it will be at a site other than the dispensary, that we will have cultivators there to teach you about their products. We will actually have people there to help you with the registration process, and we will have physicians there to actually get you the recommendation. So you can learn about what the product viability is, what types of forms there are available in PA, as well as navigate you through the registration and recommendation of the physician process, all in one-stop shop. We're trying to make it as easy as possible for anyone that's interested in the program to not only learn about it, but also get registered and actually get meet with a physician about it. Community revitalization. We're constantly giving back to the community. Right now in, I'll call it Scranton, Wilkes-Barre, that whole area, there's the Wyoming Valley Challenger League. It is a baseball league for disabled children, both physically and mentally, and it goes from 4 years old all the way up to 18 years old. We are a financial backer of them. We are helping them renovate a baseball field. We are providing donations to them for fundraising in order to complete the field renovation. We have worked with local law enforcement on helping them bring up their canine units. I personally never knew how much a canine dog cost. It is astronomical. It's not like going to a puppy shop. So we're making sure that, somehow, in some way, we're leaving a footprint within the community on revitalization. From regional, we're constantly, yes?
Are those dogs trained for marijuana?
And it depends on the state agency. Given the recent, with the act, some of the canine units, they're really used for more, what I'll say, some of their drug dogs are really used for community building, bringing them into the schools now, and having the police, the police go into the communities, have the children become comfortable with the police. So a lot of them are not used for that. I was a little nervous. I will give you a story. On one donation, they had me actually bring it over to the dog trainer, and I was bringing money from our dispensary to donate it. And I wanted to make sure that when I got on the property that none of the dogs were out, because I was terrified that my car was going to have 15 German Shepherds on it. So, it's definitely been interesting. Clinical research, veteran affairs, job fairs, rehabilitation centers, we make sure that somehow we're touching all areas regionally. And then from the state level, with Chapter 20, hopefully being able to do some of the medical research that is desperately needed within the medical marijuana community. Now, this is some of the things I wasn't sure what everyone else was going to present. This is, where to register, where you could get a list of doctors. If you actually contact the Columbia Care Facility, they will actually send you an email with hyperlinks to actually shorten the process, to point them to the DOH's website. The DOH has done a phenomenal job. It is a great resource center, from looking up physicians in the area, looking up where the dispensaries are, giving you all the information on how to obtain a card. So this is what we reference, and if you contact Columbia Care, we'll send you all the information as well. What to expect in a when you go into a dispensary. I know a lot of people have some preconceived notions of what to expect. Lolly did mention that some of them are spa-like. I could tell you that's how we've really formulated ours. A lot of natural woods, polished concrete floors. We try to make it as comfortable as possible. There will always be a licensed pharmacist within the Columbia Care facilities. That's just how we really formulate our patient care. But you can schedule an appointment online. You could actually, even if you're a returning patient, you have more questions, you can schedule online. You can call up and get an appointment. The one thing that we also do is train all of our sales associates. We have different levels of knowledge out there. So, from the basic level, sativa, indica, hybrid. But, when you get into the terpenes and the entourage effect, we make sure that we're not only talking about the products, but we're talking about the whole profile of the product and different ways to utilize it. Dry leaf and flower, it's for vaporization. A lot of people take, what's left over and throw it away, when you could actually put it in a bag, and it has a lot of calming terpene effects and a lot of common effects within that leftover remaining product that you can use into baking brownies, etc. So, I mean, you know, trying to get you the full benefit of the product portfolio that's available in PA and making sure that you're getting the use for everything with it.
Especially with cost.
Yes, yes. You know, and that's, she brought up cost. It's not covered by insurance. You know, what we do from a Columbia Care perspective is we have discounts for veterans, SSI, Medicare, Medicaid, public servants, 65 and older. You know, the cultivators, what they do is they formulate what I'll call special pricing out to some of the dispensaries. So what we do is we automatically, you know, if say their cost is, and I'm just going to use numbers, 10, and they say you could get, if you buy this many cards, you could get them for 5. We automatically bring our pricing down to that level. So whatever discounts we get from the cultivators, we pass on, because it is, unfortunately, it is an expensive option. What we try to do is make sure that you're, one, utilizing the product to its fullest extent, and then also making sure that we're trying to drive whatever costs we can out of it. And creating a secure and safe environment that, you know, when you're in there, you feel comfortable. We have a lot of people that come into our dispensary, and, you know, right now, Columbia Care probably has 5,000 registered patients. And it's amazing that I could walk around and I could tell you, you know, I might not know your name specifically, but I know you. You know, I spend time in all of our dispensaries. I make sure that I know the patients, that I talk to them, that I recognize them, because that's the environment that we have. You know, nobody gets into this business because it's a windfall. It's personal reasons why you're going into it. You know, I was in aerospace for 20 years. You know, I got offered an opportunity to work twice as many hours and make half as much money. I did it for, I have immediate family members. I have extended family members. I was reading the medical benefit. I wanted to know, how could I impact the quality of life of my family in order to get involved in this? And that's why I do it. Going into the dispensary and talking to everyone that's been on the program for months and hearing the success rate that they're having with it. You know, before, you know, at 20 years in the aerospace industry, it was all numbers. I got no satisfaction out of it. When I leave a dispensary, sometimes my wife's like, stop talking. Because the stories you bring home in just having conversations with the patients, you're fulfilled. I mean, never once said, you know, when I always grew up, I want to make money. I never thought I would get the personal satisfaction out of a job that I do out of this. You know, it's just, it's fulfilling. It really is. That's all I really have. So, thank you.
What's the question and answer? Now we're going to open up the question and answer forum. So, does anybody have any questions?
I do for Lolly.
She's first, right behind you.
I'm up for a research, and it's not until the end of March, but my doctor's going to see me in February. So if he puts it in the computer the day that he researches me, do I lose the time for a month?
No, you don't. That's a good question. Recertifications, you're prompted by the system to begin that process 60 days prior to the expiration date of your existing card and certification. The system will start sending you emails, and you have a 60-day window to renew your registration. Make sure you log in and renew that registration so that we can verify that you're still a Pennsylvania citizen, and then you can go get a certification. Then the new card will have an issue date for the day after the expiration of your existing card. So you do not lose time.
But will there be a problem if the doctor took my license away for 6 months? Since I don't have a driver's license?
Do you have a state issued ID?
I have to get one.
Yeah, you definitely get one. But you have my contact information. You know I've got your back, so if you need anything.
Thank you.
You? Yep.
Okay, thank you. Thanks for speaking, everybody. I learned a lot today. I'm coming from a little bit of a different I'm a caregiver to my husband, and I already asked him permission, but we're coming from a perspective where he was burned, third and fourth degree burns over 65% of his body. So we've had quite a journey of trying to get pain under control. My question to you is, we've done all the registration, we've gone to the dispensary, we've seen a pharmacist, but we are having trouble controlling pain. So I saw a whole menu of different preparations. On average, I guess my question is, how many visits does it take before someone feels settled with their preparation working for them? And because it's expensive, because it's cash only, we have to buy the whole dose, if that's what you want to call it. Is there an option, or will there be an option to get samples so that we don't have to pay all that for a whole dose when we already know it's not going to work?
Or if not samples, lower doses.
Answers to those questions.
I could.
Go ahead, George.
You know, success rate is your question in regards to, you know, patient visits before you really find something that's solving the issue. You know, sometimes it happens on the first visit. Sometimes it could take 4 visits, 5 visits. You know, it's a matter of identifying not only the strength, but also the profile of the product that you're utilizing. I really can't speak to samples. That's a state regulation. I have no idea when that would happen. But, you know, the one thing that we can, you know, any dispensary should be able to do is take a look at what other patients might have had success with similar conditions and slant you towards that. But it's, you know, it's unfortunately with medical marijuana and the number of different strains and terpene and cannabinoid profiles, sometimes it's a little difficult to find the correct solution. So, I mean, it really varies on the person. You know, what helps one patient might not necessarily help the next patient. So.
And keep in mind, when I say sample, I don't mean free.
Yes.
I just mean something, you know, a little bit less so that we know whether or not it's going to work.
Communication's probably key. Communication with the people at whatever dispensary you're at.
Yes.
Yeah, communication is the most important thing probably at the dispensary in terms of talking with the people that work there, because they're well versed. You know, they deal with thousands of people a week. So, you know.
The one thing that, you know, and the cultivators are doing a phenomenal job in Pennsylvania. And, you know, for example, if somebody uses a vape cart, they're building the same strains and terpene profiles into a disposable pen, which is a lower cost point. It's half the dosage. So, you know, I think the cultivators are starting to move in that direction, where you don't have to buy a gram, you can buy a half a gram, or you don't have to buy a half a gram, you can buy a quarter of a gram, just to get, you know, say, does this product work for me or not? And that's something that, you know, we could always, you know, and we continuously have conversations with the licensed grower processors in regards to what we need from a dispensary perspective to help our patients. And we're constantly talking about, you know, either larger dosages for less amount, for less dollar cost. So an example, a 1 gram cart that, you know, maybe doesn't cost exactly the same as 2 half-gram carts. We're constantly giving feedback in that sense, even for a lot of the concentrates. Maybe instead of offering half a gram, you know, offering a gram that costs less, or even bringing it down to a quarter gram, just so people can try it. There's so many strains and so many different effects, making sure that someone's able to at a lower cost point, try different products is part of the goal of the program, and it's just communication from the patient to the dispensary and the dispensary to the cultivator.
And I want to add that as Pennsylvania establishes the research program, I think everyone hopes that we will better be able to identify which strains help which patients with that research program. Right now we do have research, but it's not, some of it's not specific to, you know, which strain helps with which condition. So we will get there.
And it takes time, at least 6 weeks of continual dosing. So give yourself time.
Next. Commissioner Cummings.
Thank you. That is, this young woman that just spoke is one of the reasons that I am questioning what's happening with the medical marijuana program and how it was rolled out, because there is no research, the valid research, it's anecdotal, to help people like her so they don't have to, apparently, which I didn't know until just now, they have to continue to buy these large amounts of the product before they can, and then test it out to see if it works. If that doesn't work and they still have that product left, they go to another one. Is that how it works? Is that how you're doing this? Because that's what I was wondering. How, there is no dosage. There's no dosages for these diagnoses. So it's very concerning as a nurse to me.
Actually, there are dosages. Depending on the product, if it's a tincture, it could be a quarter milliliter, start from there.
But is that based on diagnosis, or what is that based on?
It's based off of their condition, and to the level that their body, so we always offer a dosage for every product, and it's to build off of that. So we always start everyone off at the low dosage, and then based on how it affects their system, it's the same thing with opioids. Some people are taking, a certain milligram, and they revisit their doctor and they up the dosage. So regardless if it's medical marijuana or big pharma, every person dosages do differ. And
Yeah. And you know what the greatest part is, Commissioner? If you overdose on aspirin, you die. If you overdose on medical marijuana, nothing happens.
Well, it depends on your age, which was my next question is, if you're 21 or older, you're supposed to be allowed to have this, but yet at the Capitol, I saw a bunch of kids going up to testify in front of the representatives, and I want to know how you can give kids this that aren't, there's no testing on this.
I would love to answer that question.
Yeah, because it's very concerning to me.
Yeah, I have an autistic child. So when, and I hate to say this, but until you walk into a day in the shoes of a parent of a child that has a condition, I have a child with a condition. I've watched my children suffer. And my goal of entering this program was to make their quality of life better. And trust me, it does.
And excuse me, but Lolly, she wasn't here earlier. Could you repeat your personal experience?
Yeah, so I was one of those people dragging their child to the Capitol to try to get this bill passed. I have a daughter with mesial temporal sclerosis. She did have intractable epilepsy. She now has complete seizure control. She has for over 4 years, and that is solely because of medical marijuana. She has an extremely supportive neurologist who has followed her case and wholeheartedly credits medical marijuana for her recovery. But we do have research. There has been studies done, especially in pediatric epilepsy. Dr. Warren Davinsky did do a research study on children in Colorado, and it definitely shows that it has great possibilities to treat pediatric epilepsy, which is why I'm perfectly comfortable putting my kiddo on it. But I think I was more comfortable putting her on it because I was desperate for something that would help her, because we had tried so many different anti-epileptic drugs. She was on the ketogenic diet. We did surgery consultations. Surgery wasn't a very good option for her, and no one could pinpoint if the hippocampus of the left temporal lobe was removed, would it give her seizure control? Because she does still have cavernomas in the frontal lobe as well. So those are generating seizures. The hippocampus is generating seizures. So to remove several parts of the brain, no one felt very comfortable with that as a solution. So this was the best option in front of us at that time.
And GW Pharmaceuticals actually has an FDA-approved medical cannabis drug out there. So yeah, the medical research needs to be bolstered, but given that the FDA is already approved, I think they're starting to see some of those studies come to fruition, and actually are seeing the medical benefits of it.
I understand what you're saying. I don't mean to monopolize the conversation.
That's okay.
But I get a lot of heat from my presentations. I want to make sure that I understand what you're saying. So I'm here because of that. I want to make sure I'm understanding how you're getting this information out there. As a nurse, I'm concerned. And I'm happy that it's helping your daughter or your child. But that's an anecdotal study. Where are the factual studies? Because there are none at the federal level.
If something is illegal and then becomes illegal, there was no studies prior. So we're at a starting point in Pennsylvania and moving forward. And because it's so scientific, the way that this program has been rolled out, in the future, our program will have great data compared to other states like Colorado and California. So now we're going to move forward.
Does it have a track record of the states?
I would love to provide you with some of the research that we have.
Good.
So if that would be helpful to you. No, we have research that's not
Is it controlled subjects?
anecdotal.
Because it may work for you, and it could harm someone
Right.
else. That's why you do an
Right.
actual study with controlled subjects. And the doctor is here, Dr. Christiani, is it? Okay. Because then the other issue is, like this woman is saying, if there were actual studies performed, our doctors and physicians could write a prescription and give this to this woman, and because it's based off of studies that were done that actually help burn victims, rather than guessing and having them buy these products and waste their time, effort, and money, and I just don't understand why. So in other words, what I'm seeing is that the people that are currently going to these stores and buying the product, because you're not a nurse and you're not a doctor, am I correct? They're buying this and they're being used as your test subjects? Is that what you're telling me? Are they being surveyed? Are they being asked questions?
Do you feel like test
How does
subjects?
that work?
If you're a patient in the room, I didn't think so.
Absolutely not. Well, do you have to fill
But
out
did you die?
survey? I'm not asking if that's not.
But did you die?
Are they asking questions of your?
And the way I look at it is everything started out this way. And you could take a pill and I could take a pill and we'll react differently with everyone until they start doing these studies.
Exactly.
And that's what they're doing now, but you still have to introduce it. And they've already proven some of the
The normal process would be.
Everybody needs a villain. It's perfect.
And what you have to start. This is where they start.
Which is what I just,
And it's very
because I'm
controlled.
asking, are they using your clients, the people that purchase this product, as the people you're getting your information from? Is that what you're doing?
Yes.
As I said, I have 1.5 million transactions plus for Columbia Care. And yes, we use all the data from our patients and conversations and,
So it's.
oh, no, I don't own the company. I'm actually not an owner.
Well, whoever's Columbia Care, and there is no, like pharmacists, am I wrong in saying?
I mean, that's.
I didn't say that, so don't force me. Wait, I did not say that.
Next.
I have something really important to say here.
Yeah.
In 2008, or 2007, my daughter was diagnosed with the DIPG, with the diffuse intrinsic pontine glioma, which is a very severe, deadly brain tumor. Over the last 11 years, since she was diagnosed, they put thousands of there are only 30 FDA-approved drugs for her type of tumor that will not help her or any kid. I can give you the list of names of thousands of children who died from this brain tumor with FDA-approved drugs that do nothing except put the parents into deep debt. Hundreds of thousands, $365,000 for the care of my daughter, for her to die no matter what. Every single specialist she went to see told us she's going to die no matter what. And I can give you the list of all the kids that died and the kids that are using medical marijuana that are still surviving today because of the medical marijuana with the same damn tumor. So do you want to tell me that spending $365,000 per year on drugs that are useless versus spending $50,000 a year to save your child? Which would you do as a parent? Tell me. You didn't listen though, but what does the FDA do? A phase 1 drug trial gives you the list of the dosage. Okay, and same with I had cancer, I'm a breast cancer survivor. the drugs, 2 of the drugs that they wanted to give me, I had a very bad reaction to. I couldn't take those drugs. How did they know that? They wouldn't have known unless they tried the drug on me. Same thing with the medical marijuana. They have to try it. It's a process. You gotta try something. Okay, you're allergic to peanuts. How are you gonna know you're allergic to peanuts unless you eat them? It's the same damn, you're not getting the whole picture here. You just do not want this approved. You don't want it in Scranton, Pennsylvania, so.
That's not true.
It is true. I've been to many of your meetings.
That's not true. Well, I did.
Next question, anyone?
Just very quick.
Channels? I don't think we're here to dispute the legality or anything like that. This is the Wild West. It's all brand new. Like you were saying, you know, this is something that because it was illegal for so long, they haven't had the research. The answer to the question is the research is being done. And if that isn't good enough, then just look at all the commercials that are on TV, which from the FDA, which are drugs that are grandfathered in, you know, that don't have any regulations. It's all nonsense. The point I want to make, first of all, I want to thank this gentleman, Marty Flynn, and probably the best staff in government, his staff. My question is this, excuse me. I suffer from chronic pain. I had injuries to my knee, to my back. I have an artificial knee, and now I have to get another one after 3 years. I really messed my back up, my neck up. So I'm on pain management, which I'm on opioids. And I wish that somewhere along the line, I don't mean to get off the subject here, that opioids be separated from prescription drugs and heroin and street drugs, and we get this stigma that it's all the doctor's fault that are writing prescriptions because it's wrong. Just go down my street and you'll see what I'm talking about. But I'm on pain management. And I have a very good pain management doctor. I separate my pills by the month, you know, every day, so I'm not going to overdose, and I take what I'm prescribed. But what I was told that, and this is a legal issue that I think you might be able to help with, Doctor. I was told that, and I had an experience in California. I had a medical marijuana card and I was on pain management. There wasn't any issue between using the opioid and a low-dose THC with a high cannabinol. My pain management doctor here told me that it was either or. You can take the cannabinol, right, the liquid cannabinol, and you can take that, but if there's any THC in your bloodstream when you're tested, because a lot of pain management people are really, if you haven't experienced it, you have to sign like a 5-page non-disclosure. You're treated like a drug addict, basically. Luckily, my doctor doesn't follow that line. But I can't use any of the medical marijuana, I think because of the way the law is now, it's either or. So the side effect that I got from this low dose, it's called ACDC, I think you may be familiar with it. Yeah, high cannabinol, very low dose of THC. It had a great side effect for me, and that was sleep, because I have a sleep disorder as well. But I can't get that because the law in Pennsylvania says it's either or, and I don't think that there's any exceptions. I wanted to tell you one thing real quick. Have you ever seen the movie Lorenzo's Oil?
Yes.
Okay.
Yeah. So it's not the law that you have to choose one or the other.
Yes.
For a physician to issue a patient certification, they do need to check that patient in the prescription drug monitoring system. And that is a requirement that the law requires that, but it doesn't mean that if you're on an opioid, you cannot get a certification. It simply means that the practitioner who's issuing your certification should be aware of anything that you're on that's tracked in the PDMP.
I was told either or.
There are some physicians that will not allow you to get medical marijuana while you are on opioids, but it is not a law. Personally, I give both. So to clarify that, There are some physicians that will say, okay, you're on it, it's either or, but there are physicians, but it is not a law.
It's a policy?
It's a personal policy to the physician.
Right. But a lot of physicians realize, though, if a patient is trying medical marijuana for the first time, you don't know if it's going to work, and you don't know if that patient's going to be able to afford it. So some of the patients will try medical marijuana and find either it's too expensive or it's just not controlling their pain, and they do need to, solely rely on the opioid therapy. So, taking a patient off of the opioids completely, some practitioners would not agree with for those reasons, because you don't know if the patient's going to stick with it or not.
Sorry, because I don't saw me. My question, I'm a lieutenant colonel, retired Air Force, and so I'm interested in, and I'm also a nurse practitioner, so I will comment on some of the things that were said, because I do work for a pain management practice that actually is certified, and we do recommend medical marijuana as well as tapering out the opiates. But I'm wondering what your conversations are, I guess Columbia Care specifically with the VA, because there's obviously a huge population of not only pain management but PTSD, so it's still federal. So the conversations I've had with the VA are like, we don't do anything. But I've seen some articles come across that the VA is talking, or at least contemplating the conversations about treatment for PTSD specifically. So could you comment on that?
Yes, we have reached out to the VA, and I can tell you that we haven't been welcomed with open arms. We do have a large contingent of our patients that do have PTSD that are finding success with it. You do have to be very cautious in regards to what you're recommending from a product perspective with PTSD. So we do, after we actually have a new patient, we do follow-ups with them, we call them, we email them, we see how they're doing. But the VA, as well as, some of the medical communities, are not receptive to it. So we just continue to keep on asking if we can provide education, and we think eventually they'll be open to discussing it.
Right. And then as far as the, so I'm in a practice where I'm talking to patients every day about their, and it is trial and error, a little bit about, we're learning more from the patients as far as what the process is and how it's working for them. So even with opiates, as Dr. Cruciani can probably speak to, it is still trial and error. So it's an FDA, they're FDA approved, yes, but every patient's different, and their pain tolerance and their thresholds and the type of medication they need may change. So that, is one discussion. But one of the barriers that I see with a lot of the patients are the fact that it's okay for them to be on high doses of morphine. They're in these positions that I'm surprised that they're allowed to be on the legal form of, pain management, but they can't go on the medical cannabis because of drug screens. And so the biggest, if they're, any kind of federal contracting job or law enforcement or even the medical community, they could benefit, and they know they could benefit, and they're interested in it, but it makes no sense to me as a practitioner that, they're gonna get drug screened, they're gonna have an opiate in their system, and that's okay, being a cop or whatever, you know what I mean? That's a concern to me as a community member, but they can't risk getting caught, getting THC in their urine. So how do we deal with this as a...
That has to do with federal classification, so...
That's a good question, but if you just look at the trend and the way things are moving, you look at Pennsylvania, for instance, we're a very conservative state in terms of laws. Federally, it's probably going to happen before it happens in Pennsylvania, to where it's fully legal for adult recreational use. The trend nationwide is the former Speaker of the House, Republican Speaker of the House, Boehner, is now working for the marijuana lobby. So, I think in the next 5 years, you're going to see significant policy reform in terms of Schedule I. I'm sure the science is even going that way in terms of testing for intoxication, things like that. It's going to be pretty much aligned with alcohol soon enough, I think.
We also have to normalize it. We have to talk about it. We have to not, people who can be talked about it without fear of losing their jobs or anything else.
And that's
It
what this
has to be
stuff-
talked about just like a drink.
Yeah.
Hi, I just wanted to speak to the issue with respect to veterans. Although you're absolutely correct, there are no physicians that work at VA hospitals who have the authorization to issue certifications. The VA issued a policy statement, I believe it was in May of last year, don't quote me, it may not have an exact date, where they said that veterans will not lose their disability benefits, their health insurance, their retirement benefits if they participate in a legal state medical marijuana program. So although the VA has not come so far as to promote it for the treatment of PTSD, they have gone so far as to say, we're not going to threaten, your benefits are safe if you go ahead and utilize this treatment for your PTSD. So I just thought that was very useful. We're headed in the right direction.
I can relate to Wally's situation. I have a daughter who has a life-limiting degenerative condition that falls under the mitochondrial category, and every organ in her body is affected. It gradually just degenerates everything. Anyway, her disease presented with epilepsy, and we went, all along the East Coast trying to find somebody who could try to figure out what was going on with her. Anyway, we did end up getting somebody, but now the questions I have is she has Medicaid, okay? If this is not covered by Medicaid, how can you get a fee reduction? Did I understand that correctly?
You did, because the Department of Health will allow you to.
Okay, and
It's not, Medicaid's not picking up the remaining cost. We are giving you a discount because the patient qualifies for a program, okay?
Now, was your daughter able to come off of all of the anti-epileptic drugs? My daughter's on 4.
Yeah.
So, that's good.
But it took time. It wasn't, we did not have immediate results, and we were not able to wean her off of the anticonvulsants for some time. So while she's been seizure-free for over 4 years, the beginning of that, she definitely was still on anticonvulsants until I could safely wean her off of them. Because while they weren't helping her, she was still on 2 that weren't hurting her. Because a lot of the anticonvulsants she tried would actually make her seizures worse. You've probably seen that.
And there are programs like GoodRx that pharmacies use for people who don't have insurance, and you can get, your drugs at a reduced price. Is there any kind of a program like that with these?
Thank you for bringing that up. So one thing I did not mention, and my apologies, the state will have a financial hardship program established. So we are moving towards establishing that program. Chapter 9 of the Act lays out sort of the framework for that financial aid program that we will be offering. I don't have details on it yet, but like I said, we are definitely moving towards that. And as George mentioned, a lot of the dispensaries do offer discounts for certain populations as well.
You may have addressed this already, but should you have an adverse reaction, is the dispensary open with a medical professional 24/7?
No.
No. Okay, so in that type of a case, going to a hospital, and first of all, would a hospital even administer medical marijuana if it's a non-formulary drug? So as far as like a reaction would happen, because my daughter did have a near-death experience because of a medication that went against her condition and caused her to have a stroke and left her with a number of problems. But we ended up having to go out of state to New Jersey to find the epileptologist who eventually got her condition confirmed. Now, should she have to go into the hospital in New Jersey, what's about crossing state lines?
You cannot
Okay,
cross state
you can't-
lines.
You can't cross state lines, okay.
Well, we have a question for Mr. Miller, if we just move on here.
We can chat more afterwards.
Yes, have my medical marijuana card. How many times can you go to get your medical marijuana? Is it once a day, once a week, once a month?
Well, a patient is only allowed to be in possession of a 30-day supply. Now, the Act did not define 30-day supply. The 30-day supply should be determined by the medical professional that you are consulting with at the dispensary, but we are working on setting guidelines for that 30-day supply, or rather limiting that 30-day supply. Just for diversion prevention, we don't want to limit what a patient needs, so we want input on that. So if anyone has any input, anything you want to share about your needs monthly as a medical marijuana patient, we do need to hear from you.
Yes, also, my card expired January 24th. We went January 22nd on an open day and the store was closed. Why? There was no sign or nothing. And talking about Kaiser Ave.
Was it Tuesday?
We're always, the only time that we closed was during the snowstorm, and we closed at 5 p.m. instead of 6 p.m. Every other operational day that we say we're open, we're open. Kaiser Ave is closed on Tuesdays and Sundays. And we're talking, it's always been that way.
On the door it said Monday, not Tuesday.
It was a weird day.
I'll go down there and take a look, but I mean, we were never open on
You guys are great
Tuesdays.
when we go, though. I love that
Good.
there's a pharmacist there.
Good.
It's very secure, like you said. The people there are amazing. They're great.
Good,
They
I'm
talk with you. They work with you. Very good.
Well, and we also understand that that's a pretty heavy traffic dispensary. So we actually are going to be extending hours to alleviate, open up more hours for people that are, maybe working later. So we are in the process of bringing on staff to open up on Tuesday, and then also extend our hours to 8 p.m. For each day. So we'll only be closed on Sunday.
Right.
Just to make it a little bit easier. But as you know, our pharmacists, they hand out their business cards. It has their cell phone, it has their email. They answer emails and phone calls all the way till 11 o'clock at night. So.
Yeah. They're very good there. I will admit, like with my husband with his ALS, they go over everything, all those medicines. They were very great, and they worked very well.
I'm very happy.
Thank everyone for coming out today for our first annual medical marijuana seminar. And next year, hopefully we'll have more statistics, being that this is the second year the program is implemented. So as we move forward, thank you for coming.